It respects no borders and spreads rapidly across the globe. COVID-19 has left many countries, including Malaysia, economically shaken. Unemployment has hit its highest levels in a decade, and the economy is expected to contract between -3.5 and 5.5% this year.
Assalamualaikum and a very good evening. My name is Nur Hakimi bin Jamaluddin and my group consists of 5 members: Muhammad Shakil, Nur Hakimi, which is me, Nur Anik Shamif, Nurul Ain, and Tivnesh Kumar. So our group did a research about COVID-19 pandemic impact the poverty rate in Malaysia. So poverty has been the major problems for many years despite the worlds that keep evolving. Therefore, eradicating poverty is the first goal of the United Nations Sustainable Development Goals, SDG. However, the COVID-19 pandemic has caused a crisis globally, and Malaysia has controlled this COVID-19 infection by announcing the Movement Control Order, or MCO. MCO has required major economic sacrifices, and it threatens the Malaysians' household budget as people working in private sector, government sector, they are being forced to function remotely, or they're just being let off by the company or industry because the industry they serve has been halted due to this pandemic.
Hi, my name is Muhammad Shakir bin Roslan. So today I'm going to present about the problem statement. The COVID-19 pandemic had a negative effect, especially in terms of finance, such as sellers of food stalls and morning pop-up markets were ordered to close due to the government's MCO. Many Malaysians therefore are facing financial problems, especially in the B40s. Workers, either daily paid or part-time, have been terminated by their employer as a result of MCO restrictions. This causes poverty to grow sharply and increases drastically in Malaysia.
Hi, I'm Tivnesh. Today I'm going to talk about the research questions. The first question is, how has COVID-19 pandemic impact the poverty rate in Malaysia? The second question is, what are the levels of awareness and understanding among public service practitioners of the value and effects of poverty due to COVID-19 in Malaysia? The third question is, how can people that are facing poverty in Malaysia be supported by the government and individuals or public? Now I'm going to talk about the hypothesis. Poverty rates in Malaysia, especially in urban areas, have been affected significantly by the COVID-19 pandemic compared to the before pandemic. The levels of awareness and understanding among public service practitioners of the value and effects of the poverty is increasing during COVID-19 pandemic in Malaysia. People that are facing poverty in Malaysia can be supported by the providing financial assistance, basic necessities, and charity or donation for them by the government and the public or individuals.
For the literature review, we have reviewed more than 20 articles, and these are 2 of them. From the first article written by Putri Marjan Megat Mustafa and Tibalakshmi K 2020, which is the impact of COVID-19, 3 major threats: money, food, and living condition. This article stated that the issues of population are more likely gullible to the urban poor, those with a few financial resources, low income, and those who live in a crowded area, such as flats and high density area, are very much likely in high risk of getting infected from this disease. So from the second article from Fatima A 2020, the relationship between sustainable development goals and the prevention of pandemics, saying that this lockdown make it hard for the person who live in urban area to survive because they depend on their income. So in this situation, a strong economy exists if the country facilitates its citizens by making availability of daily usage things to the maximum limits. For research methodology, we use two types of research methods. One of it are web-based data collection, app where we use Google Form, and another one is reviewing online and from journal and articles.
So hello guys, my name is Shamif. So I will continue of the presentation. I will present about data collection and data survey based on our survey form. For data collection, we managed to get feedback from 50 different respondents that fill out our survey form. 39 of the respondents is female and the other rest are male. The age range of our respondents are from 70 to 45 years old. For this part, this is occupation data that we collect from our respondents. As you can see, majority of our respondents are students with 30 respondents and minority of them are unemployed with only one respondent. Next, I will talk about data analysis for the first question that you can see. 94% of respondents are aware about poverty issue in Malaysia and some of respondents are not. For this result, it is a positive sign for the country as the majority of respondents have good awareness on what is happening in our country. For the next question, we do ask our respondents do they or their family members lost job during this pandemic, and what we observe that almost half of the respondents or their family has lost job during this pandemic. This shows that COVID-19 pandemic have given a huge negative impact towards people nowadays. It might be a problem to some of people, such as lose their source of income and could lead them into living in poverty. For the next question, we can see that majority of respondents have no problem with financial to buy basic necessity. However, there are 6 respondents are having financial problem. Maybe if we can see that number of respondents is low, but it is still quite worrying situation because basic necessity such as food are very important for us as a human being to survive in this world. For the last question, we ask our respondents to give their opinion about steps that can be taken by Malaysia government or non-profit organisation to help people that live in poverty during this pandemic. Majority of respondents said that the government should provide basic necessity to one in needs, increase the job opportunities to more people outside, increase the minimum wage of workers, and do charity and donation for people that more in needs. Some of the opinion from respondents already be done by the government or non-profit organisation to help people that affected by this pandemic, such as provide financial assistance. Malaysia government has distributed one of financial assistance, which is like being called Bantuan Pelik Hati Nasional (BPN) to the Malaysia citizen. This initiative be taken to reduce people burden during this pandemic time. That's all. Thank you. I will pass to my friends.
There are couples of limitations while completing this study, such as the first one is the method used are online based. Thus, there are no face-to-face interviews or going out seeking for employees to get them to answer our surveys. We just share our surveys and questions through an online platform. And second one is time constraint, where we are given a limited and specific time to complete this study or task. And the last one is limited resources, where there are not as many articles about COVID-19 impact on poverty, especially in Malaysia. So the resources are quite limited.
From this research, we can conclude that the COVID-19 pandemic has grown into a health, socio-economic, and humanitarian crisis of unprecedented scale and impact. It also brought more negative impact compared to positive impacts to families, students, workers, and all of the community, not just in terms of financially, but also in terms of mental health and more that can be observed. We ought to turn the recovery into a real opportunity for the future to do it right. Better recovery and reconstruction means not returning to business as normal, but seizing the chance to create a healthier, a greener, and more resilient economy and a community that leaves nobody behind.
Malaysia has fallen into a recession. Its GDP fell 17.1% in the second quarter, its deepest contraction since the 1998 Asian financial crisis. One can only hope that the pandemic will disappear much sooner rather than later.